Today we're going to discuss the fitting techniques on a Stat-A-Dyne Elbow flexion extension device. We're going to start distally on the device and look at these two wing nuts here, which allow the cuff to either be tilted or telescoped. The advantage of that is we can have the distal cuff and the proximal cuff fit well in regards to soft tissue distribution of pressure. The next thing we're going to look at on both the distal cuff and the proximal cuff is the fact that this is the only contracture management product in the marketplace that has an adjustable carry angle. So we can actually take the distal cuff as well as the proximal cuff and move them in a medial lateral fashion in order to align the product well with the valgus or varus of the elbow. In order to apply the product can be slid onto the arm in this fashion. We want the hinge of the product to center itself well on the elbow joint, and we would want the distal cuff telescoped out far enough to where we have a good longitudinal application of the product, but where the patient could still extend and flex the wrist and not run into the distal cuff. After the cuff is placed in that fashion on the distal part of the product, the Velcro can be fastened. On the proximal part of the product, in regards to the proximal cuff, we will want 3 fingers in the axilla, following the same principle on a crutch in physical therapy to make sure we don't impinge the brachial plexus. Once that is in place, the strap can be fastened and the product is ready to be utilized. That is the fitting techniques on a Stat-A-Dyne elbow flexion extension device.